Hello friends, today I am going to teach you regarding the neoplasia. This is the basic introductory lecture of the neoplasia. We will discuss regarding the nomenclature of the different tumors and the basic difference between the benign and malignant tumors. So let's start the discussion regarding the neoplasia. So what is the literal meaning of neoplasia? It means new growth. So any new growth can be neoplasia. Now what is the scientific definition of this neoplasia? So the definition is include abnormal formation of the mass of the tissue which grows autonomously and the rate of growth is exceed that of surrounding normal tissue. I mean the growth is autonomous. It is not in our control. It is not in our control of body. You might be familiar with the hyperplasia. The hyperplasia means increased number of cell. But this is under control of our body. In neoplasia, what happened? The control is totally lost, and the rate of growth is very high as that of surrounding normal tissue. That is the neoplasia. Now we can further add that this growth is excessive and remain in same excessive manner even after cessation of stimuli which evoke the changes. For example, if you are working in the asbestos industries, you have got asbestos exposure, then you might develop lung cancer after many years although the exposure has been stopped. So this is the complete definition of the neoplasia. Now this tumor or neoplasia basically can be divided into two types. Either it can be benign or it can be malignant. Now this two differentiation is very important. Why? Because the prognosis is excellent in benign tumor while the prognosis is very poor in the malignant tumor. So first of all, benign tumor, it is the localized tumor. For example, this is your forearm and you develop tumor below the skin, so you are having the subcutaneous lipoma. So this is the benign tumor. It is localized. Usually it is well encapsulated and it doesn't spread distally or nearby tissue. It will not spread. It will remain localized. It might increase in size so that it can compress the surrounding tissue, but it will not increase in size. So the prognosis is very good and the treatment is just removal of this tumor. You can remove or you can excise the tumor. The prognosis is very good. Now malignant tumor. As compared to benign tumor, the malignant tumor is more aggressive. So suppose this is the malignant tumor over the forearm. Now this is the aggressive behavior. It is having the aggressive behavior and it can invade and destruct the surrounding tissue. So it can destruct this nearby tissue. It can destruct all this tissue. While benign tumor just compressing it. Now what happened? Sometimes malignant tumor from its original site can spread to the distal organs. For example, this tumor spread into the liver, into the spleen, or into the kidney, or into the adrenal gland. This tumor is spread distally into the different organs, and that is known by the name metastasis. It is the peculiar characteristic of the malignant tumor. Metastasis will always seen in malignant tumor. Now this malignant tumor in the early stage can be curable, but if it is advanced, then it's difficult to treat. Now basically, any tumor is having two components. One is tumor mass, right? One is the tumor cells. That is known as tumor parenchyma. It is the neoplastic cell or transformed cell. It is the tumor parenchyma. While the supporting stroma around the tumor is known as supportive stroma. Now, what is the structure of that stroma? Parenchyma is made up of neoplastic cell, but the stroma is host derived. Means it is made up of blood vessel, fibrous tissue, muscle, adipose tissue. So that is included in the stroma. Mainly it is made up of blood vessel and the fibrous stroma. If this stroma is invaded by the tumor cell, means the tumor cell invading or destructing the stroma, then it is the feature of malignancy, or else it is the benign tumor if the stroma is not invaded. So that is the two basic components. Now we will see how the nomenclature of the tumor is done, means how will you give the name of particular tumor. So you are familiar that at the one end there is a benign tumor, and at the another end there will be malignant tumor. The benign tumor, for the nomenclature of benign tumor, you have to add suffix oma to the cell type from which the tumor arises. For example, if the tumor cell is arising from the fibrous tissue, then the benign tumor of fibrous tissue is known by the name fibroma. So any benign tumor is known by the suffix oma. For example, if the tumor is in the blood vessel, then the benign tumor is known as hemangioma. So the oma is added for the benign tumor. Now the nomenclature of malignant tumor. If malignant tumor is made up of epithelial cell, or the cell of origin is epithelial cell, then it is known as carcinoma. And the malignant tumor of the mesenchyma is known as sarcoma. So the malignant tumor is known by the two names. If it is made up of epithelial cell, then it is carcinoma, and if it is mesenchymal tissue, then it is sarcoma. Now we will see example. For example, you develop the malignant tumor of the squamous cell, right? Then it is known as squamous cell carcinoma because it is epithelial cell. Another example, if you are having malignant tumor of fibrous tissue, then it is given the name fibrosarcoma because the tumor is arising from mesenchymal tissue. Fibrous tissue is one of the mesenchymal tissue. So in that way nomenclature is done. Now we will see examples in detail. So now this is a master table of the nomenclature according to the tissue of origin. It consists of one parenchymal cell type. The tumor parenchyma is of that one cell type. I mean the cell type is only one. If we are talking regarding fibrous tissue, then it is pure fibrous tissue. If we are talking regarding blood vessel, then it is only blood vessel. Means it is the one parenchymal cell type. So now let's start the discussion. First, fibrous tissue. The benign tumor of fibrous tissue is obviously, for the benign tumor you have to add suffix oma. So it is known by the name fibroma. It is a mesenchymal tissue. So malignant tumor is known by the name fibrosarcoma. The tumor arising from the bone is known by the name osteoma for the benign tumor, while the malignant name is given the name osteosarcoma. Chondrocytes, that is the cartilage. Benign tumor is known as chondroma, while the malignant tumor is known by the name chondrosarcoma. Obviously, it is the mesenchymal tissue. That's why sarcoma is added. The suffix sarcoma is added. The benign tumor of the adipose tissue is known by the name lipoma, while malignant tumor, yes, you are right, liposarcoma. If the tumor is arising from the blood vessel, then the benign tumor is known by the name hemangioma, while the malignant tumor is known by hemangio or angiosarcoma. If the tumor is arising from lymphatic vessel, then the benign tumor is known by the name lymphangioma, while the malignant tumor is known by the name lymphangiosarcoma. Here is the exception. The brain covering tumor is known by the name meningioma, but the malignant tumor is not known by the name meningiosarcoma. It is known by the name invasive meningioma. So in this example, the sarcoma suffix is added because all these are soft tissue. It is the mesenchymal tissue. That's why sarcoma suffix is added. Still, we will continue with the example. If the tumor is arising from striated muscle, then it is known by the name rhabdomyoma. Benign tumor is known by the name rhabdomyoma, while the malignant tumor is known by the name rhabdomyosarcoma. Suppose the tissue of origin is the smooth muscle, then the benign tumor is known by the name leiomyoma, while the malignant tumor is known by the name leiomyosarcoma. Now, if the tissue of origin is the liver cell, then the benign tumor is known by the name adenoma, while the malignant tumor is known by the name hepatocellular carcinoma. Until this example, we have seen only the example of mesenchymal tissue. Now, this is the epithelial cell malignancy. Liver cell is the epithelial cell. So, the malignant tumor is known by adding the suffix carcinoma. That's why it is known as hepatocellular carcinoma. Suppose the tissue of origin is that of stratified squamous cell. Usually it forms the papillary structure. That's why benign tumor is known by the name squamous cell papilloma, while the malignant tumor is known by the name squamous cell carcinoma, because it is the epithelial cell. Suppose the tissue of origin is that of basal cell, then the benign tumor that consists of basal cell doesn't exist. Usually it is the malignant one. So the malignant tumor of basal cell is known by the name basal cell carcinoma. Clear? If the tumor cell forming the gland, if the glandular pattern is seen, then it is known by the name adenoma. Remember, it is very important. The gland forming tumor is known by the name adenoma, benign tumor. But suppose if it is malignant, then it is known by the name adenocarcinoma. If the epithelial cell is forming papillary structure, finger-like projections, then the benign tumor is known by the name papilloma, while the malignant one is known by the name papillary carcinoma. Suppose the tumor is arising from the renal epithelium, then benign tumor is known by the name renal cell adenoma, while the malignant tumor is RCC, renal cell carcinoma. Suppose the tissue of origin is that of transitional cell, then the benign tumor is known by the name papilloma, while the malignant one is urothelial carcinoma. Suppose a tumor is arising from placental tissue, then it is given the spatial name, that is hydatidiform mole, while the malignant tumor is known by choriocarcinoma. If the tissue of origin is that of testicular germ cell, then the malignant tumor is known by the name seminoma. This is very important exception. Here oma is added. Instead it is malignant tumor. Usually oma is added to the benign tumor, but here in the malignant tumor also oma is added. This is one of the most common exception. So suppose if you are having more than one parenchymal cell type, then there is two example: pleomorphic adenoma and the malignant mixed salivary gland tumor, benign and malignant counterpart. In the renal analytic, it is known by Wilms tumor. So this is the example of one parenchymal cell type with one germ cell layer. But suppose if you are having the tissues of different germ cell layer, means more than one germ cell layers and more than one tumor parenchymal cells, then it is known by the name teratoma, in which you can able to see the structures of the ectoderm like skin, structures of the mesoderm like that of blood vessels, fibroblasts, etc., and from the endoderm, intestinal epithelium, etc., might be seen. So that is the example of teratoma, in which there is a presence of more than one germ cells and more than one tumor cell parenchyma, more than one parenchymal tumor cells. So that is the basic regarding the nomenclature. Hope you can clearly understand the master table, that how nomenclature of the tumors is done. This is the example. This all is the example of only one parenchymal cell type. Clear? The tumor cell type is of only one type. If you are having more than one parenchymal cell type of tumor, then there is two example: pleomorphic adenoma and malignant mixed salivary gland tumor and the Wilms tumor. This is the example of more than one parenchymal cell type, but the germ cell layer is one. If you are having more than one germ cell layer, then it's the teratoma. Okay, now we will see the feature of malignancy. So before I teach you about the anaplasia, You should be familiar with what is differentiation. Now I will give you the example. Suppose there is a two monozygotic twins. Then they will look ideally to each other. I mean, they are similar in the look, so that is known as well differentiated. Similar principle is applicable in the tumor. Suppose if you are having the tumor that is arising from liver, the benign tumor of liver is known by the name adenoma. Suppose this tumor is having the cell that is having resemblance equally to that of tissue of origin, then it is well differentiated. Means it is the degree of resemblance of the cell morphologically and functionally to that of normal tissue. If the tumor cell, suppose this tumor cell looks exactly like that of normal liver tissue, then it is known by the name well differentiated. Suppose it is not exactly looking like that, but it is somewhat similar, then it is known as moderately differentiated tumor. And suppose your tumor is not at all resemble to like that of tissue of origin, I mean you cannot say microscopically that this is the tissue of origin, then it is the poorly differentiated tumor. So that is regarding the differentiation. So if such a differentiation is lost, then it is known as an anaplasia. And anaplasia is the hallmark of malignant transformation. This moderate to poorly differentiated tumor can always be malignant tumor. So this is regarding the anaplasia. Okay, now we will see the basic difference between the benign and malignant tumor. So first we will see the clinical and gross features. The benign tumor is usually well circumscribed round. I mean it is round and well circumscribed, while the malignant tumor is poorly circumscribed. Clear? The size is usually small, while the malignant tumor is large. The surrounding tissue is always compressed by the tumor cell, while here the malignant tumor can invade and destruct the surrounding tissue as well as it can spread distally, that is known as metastasis. Now microscopic difference between the benign and malignant tumor. Now this is very important, that we will see in the figure later on. Growth rate. The growth rate of benign tumor is slow, while malignant tumor grows very rapidly. The metastasis is obviously absent in the benign tumor while it is present in malignant tumor. Now this is the microscopic feature of the anaplasia. This is the main difference between the benign and malignant tumor. All these features of anaplasia is seen only in the malignant tumor. This is only seen in the malignant tumors. So which are that features of anaplasia that is absent in benign tumor? Just see. The first difference is basal polarity. In the benign tumor, the basal polarity means orientation is well maintained, while this orientation or the basal polarity is lost in the anaplastic feature, means in the malignant tumor the basal polarity is lost. Second very important point is the pleomorphism. The benign tumor, just see this benign tumor, their looks similar, right? The nucleus and the cells looks very similar. There is no variation in size or shape. But see this malignant tumor. This nucleus is very large. This is very small nucleus. This cell is very large while this cell is small. So this variation in the size and shape of the cell and the nucleus is known by the name pleomorphism. So the pleomorphism is seen in malignant tumor, means variation in size and shape. So this variation in size and shape is known by the pleomorphism and seen in malignant tumor. Now second very important point. See this benign tumor. What is the nucleus to cytoplasmic ratio? Can you appreciate? Yes, the nucleus is very small and cytoplasm is very abundant. So the ratio is 1:4 to 1:6 normally. The nucleus Suppose the cytoplasm is 4 times to that of nucleus, or sometimes can be 6 times to that of nucleus, but this NC ratio is altered in malignant tumor. See, here it is 1 by 1. So in the malignant tumor, NC ratio will be high. Usually it is 1:1. It is not 1:4 to 1:6. And isonucleosis is also seen, means variation in size of nucleus. Now, very important point. In the malignancy, the cells are rapidly dividing. So there will be increased DNA in the nucleus. The DNA will be increased. So this nucleus will be stained very dark. That is known as nuclear hyperchromatism. That is present in only malignant features in the malignancy. Now, sometimes what happen in the malignant tumor? Sometimes you can able to see the unstained portion in the central of the nucleus. That is known as nucleoli. This nucleoli is present only in the malignant tumor. Now, in the malignancy, there can be presence of abnormal mitosis, suppose like that of flower shape. So, such abnormal mitosis is seen only in the malignant figure. In the malignancy, you can able to see the tumor giant cells with the anaplasia. Suppose you are having the mucinous adenocarcinoma, then sometimes mucin formation also can be seen. And obviously DNA aneuploid is seen, that is related to genetics. We will discuss in the genetic chapter. So these are the features of the anaplasia: loss of basal polarity, pleomorphism, high NC ratio, anisonucleosis, nuclear hyperchromatism, prominent nucleoli, abnormal mitosis, and the tumor giant cells, and sometimes mucin production. So these are the features of the malignant tumor. It can be asked in the exam as well as can be asked as an MCQ. So remember the features of malignant tumor. Clear? The difference between the benign and malignant tumor is based on clinical features, then microscopic features, growth rate, and metastasis. So in that way you can differentiate the benign and the malignant tumor. This is the example of benign tumor. Just see, the stroma is totally free, it is not invaded, and this is the pure benign cells. No high NC ratio, no pleomorphism. This is known as benign tumor. This is the tumor of the breast. The breast is one of the gland, and the fibrous tissue is seen. That's why benign tumor of the breast is known by the name fibroadenoma. This is the case of fibroadenoma of the breast. This is the malignant tumor. Just see how large is the nucleus. You can able to see the prominent nucleoli as well, and there is no stroma in between the cell. The all stroma is invaded by the by the pleomorphic cells, by the malignant cells. They are invading the stroma. That's why it's the malignant tumor. This is the case of endometrial carcinoma of the uterus. So this is all about the basic introductory lecture of the neoplasia. Hope now you can able to do the nomenclature of the tumor. I mean, suppose if I am telling that this is a case of liposarcoma, then you should be familiar that it is the malignant tumor, mesenchymal tumor of the adipose tissue. So with this lecture you might be able to do the nomenclature of the tumor, and you can able to understand the basic difference between the benign and malignant tumor. Hope my video will be beneficial to you. If you are liking my video, then subscribe my channel and press the bell icon so that you can get notified whenever I am posting the new videos. Thank you very much, guys.